Okay, we'll go ahead and get started. We have a few other people jumping on a little bit later, but we'll go ahead and start with everyone that's here on time. So again, my name is Alejandro Vegas with the Fresno County Department of Public Health. And do we have any other members from Department of Public Health on the call today?
Hi, this is Rebecca, public health nurse, planning lead.
Hi, John Zweifler, medical consultant, Fresno County Department of Public Health.
All right. Thank you very much, everyone. And I think we have Ahmad with behavioral health on the call, correct?
Yes.
Thank you, Ahmad, for joining us. We'll go ahead and get started. We'll let you jump in unless you got to jump off early.
No, I can jump in whenever you guys need me to.
All right, perfect. Again, so we'll go ahead and get started. We'll start with a few numbers and a little bit of updates. Since it's been a while since we've met, our total confirmed cases in Fresno County as of right now it's about just over 105,899. We're about a 15.3 cases per 100,000, and that's a 7-day average. Reported as of the 4th of this month, it's about 167 cases here in Fresno County. Our deaths are about 0.6 deaths per 100,000. Again, that's a 7-day average, and that's just a +1, about 0.1% increase. We're looking at some of the positive patients here in our county area, where it's about 164, with ICU patients at 31. Now, if we were looking at this in a tier-based system, if we were back in those colored tiers, if we're looking at our case rate, it'd be about a widespread. So that would mean that we were in purple, but obviously the tier system is gone now, so that's not the case. But that's how it would kind of look, and our positivity rate would be on the red side. And again, these numbers lag behind a little bit as the state always updates based on a 7-day average or those 14 days prior, as we were doing back in the day. But I think the major thing to notice is that anything over those 10 cases per 100,000 was considered significant spread. Has been increasing as we've been moving along the last couple of weeks. So that's why the importance of getting vaccinated is one of the huge factors that affect the overall cases per 100,000 and overall positivity rate. So the majority of new hospitalizations are also due to non-vaccinated folks. So that's a huge issue in our community as well that we're dealing with. I know a lot of people also have questions on masking, so I'll go ahead and give a refresher on that. And this is from the CDPH website. And again, if you guys have additional questions or information, we can make sure to answer those questions after I give this update, and we can send out the links to this. So everyone is required to wear masks in the following settings. Again, public transportation, healthcare settings. Those include long-term care facilities, adult and senior care facilities, K through 12 schools, childcare, and other youth settings, state and local correctional facilities and detention centers, homeless shelters, emergency shelters, and cooling centers. Masks are required for unvaccinated people and recommended for everyone else in indoor public places, like retail, restaurants, theaters, family entertainment centers, meetings, state and local government offices. And there's obviously a few exceptions to those rules. Children who are under 2 years old, people with a medical condition, a mental health condition, or a disability that would make wearing a mask difficult, and people for whom seeing the mouth is essential for communication, such as those who are hearing impaired, and people for whom wearing a mask would create a risk at their work site. And obviously you would check in with your local work setting for that information. And as we know, different employers may require you to actually be vaccinated to be on site, and that would depend by each facility, or to wear a mask, I mean. But again, I'll go ahead and open it up for a couple updates from our vaccination team. Our vaccination team, and from Dr. Zweifler as well.
Well, thanks, Alejandro. So I think everyone is aware that we're experiencing a pretty dramatic increase in cases related to the Delta variant. The number of cases is increasing dramatically in all age groups. We are not seeing as rapid a rise in hospitalizations, and that is probably because that a lot of the individuals who are most vulnerable, most at risk, including our elderly, have been vaccinated at much higher rates. So we can anticipate that, and what we've seen is that hospitalizations have increased about 4 times from where they were from about a month ago when they were at their lowest point. They're still considerably lower than what they were at the peak back in the winter, but we can expect those numbers to continue to go up. And when we see increases in hospitalizations, unfortunately, the next phase that we see is there will be some related deaths. And what's discouraging about that is that we do have the vaccines available, so we would consider all of these to be preventable deaths. At the same time, we're also what's so difficult about this particular surge is I think a lot of us had felt like, geez, we got through this. We got through the last big surge. We're opening up and we're ready to get on with our lives. And then to have this uptick as I think has been discouraging for a lot of individuals. But as we're faced with this, we're faced with decisions with how can each of us protect ourselves in the best possible way. And to think about that issue, we can just back up a little bit and remind ourselves that COVID is a respiratory virus. It's transmitted when we cough and sneeze or talk. You're most at risk for getting COVID if you're indoors, if you're in a crowded setting, if you're around other people who are unvaccinated, or if you're around people who are unmasked. So if you think about those situations, particularly for the faith-based community, it's indoors, it's crowded. So the only the mitigation tools that we have at our disposal is either to ensure that everyone's getting vaccinated or that everyone's wearing a mask. So the CDPH has recommended that everyone wear a mask indoors. This is a change from before, which was if you were vaccinated, you did not have to wear a mask while you were indoors. If you were unvaccinated, you were expected to wear a mask indoors. And the rationale for that, I think, is twofold. First of all, we have seen some breakthrough cases with Delta, people who are vaccinated. In general, it's milder and they're much less likely to be hospitalized. If you look at who's in the hospital with COVID now, it's well over 90% are those who are unvaccinated. So even if you do get COVID when you're vaccinated, it tends to be milder. But there is some evidence that if you have been vaccinated, that you can still transmit the COVID and the Delta variant in particular. So given that, wearing a mask, even if you're asymptomatic, can help protect others. And at the same time, wearing a mask protects you as well. So we're basically encouraging everyone to wear a mask when they're indoors in crowded settings, and particularly when you're around others who are not vaccinated. And again, that pertains to the faith-based community. So it's not what any of us want to hear, but I think the reality of where we're at. If we want to protect ourselves, our families, loved ones, and our community, well, we should make sure that all of us are vaccinated and that we wear masks in those crowded indoor settings. And I'd be happy to answer any questions that folks might have.
Did you say you're able to take questions?
Yes.
Yeah. Would you be able to elaborate on the correlation of infections to death over any period of time, as long as, it goes back even a few months? It seems like there's, because of the number of people vaccinated, and to your point, the people who are really vaccinated, a lot of the elderly, so the people who are showing up in hospitals have less of those comorbidities than the elderly had. And so we've seen a fortunate break from infection to death. Are you able to speak to that correlation at all?
I can't give you exact numbers off the top of my head. What we are seeing increased deaths in the United States. So, Fresno County is a microcosm of the United States and the world, but deaths are increasing in the United States, just as hospitalizations are. And the deaths are a lagging indicator. So I think we can anticipate that deaths will continue to increase in the weeks ahead. I don't expect that it will be to the degree that we saw with the prior outbreak for the reasons that we already talked about, but there will certainly be some deaths. And the exact numbers, I can't tell you. In the United States, we've had over 600,000 deaths. I think there's been around 35 million cases. So I mean, you can do the math in terms of the rates of, it's a couple % of people who end up hospitalized or end up dying. Whether it will continue at that clip, I suspect it will be a little bit less than that with this round, but I think the final toll is not yet in.
I hear that. Just to express what we're experiencing on the faith-based side, I mean, I don't know how many people are on this call anymore, but I've stuck through this for the whole 18 months, and I feel like there's maybe 10 of us here now. And I'm just confessing to you that it feels very discouraging, because early on, I was even a person who was like, stop calling this the flu. This is not the flu. It's worse than the flu. I have family members in the medical profession, but right now I'm feeling like, being a numbers person myself, that there's now evidence to show that the people getting sick obviously are vaccinated, and that's their choice to get vaccinated or not. I can't force them. And so when I see, nationally, it's in the 300 to 400 range right now of people dying. That's a 7-day average, as you pointed out. That number is far less than even flu and lots of other numbers right now, which we're not doing nearly as much for. And so just expressing to you how difficult it is going to be to tell people, especially those that are vaccinated, that they should now get vaccinated, and to what end? Wait for the unvaccinated to finally change their mind? You've not given us any sort of, when hospitalizations are low, because they're low, you're not maxed out anywhere near you were before. When the death rates are low, they are low. They're very low. You just stated how low they are. What's our end game? What sort of light at the end of the tunnel can we give people? I understand people are going to die. That's not lost on me, and I'm not happy about that. But people are dying in car accidents every day and everything else. And so numbers really help to give us metrics to explain where there's a light at the end of the tunnel. And just on behalf of me and my church, we have nothing to convince our people anymore. Everyone who wants to be vaccinated has been vaccinated. Those that won't. And those that wear their mask waiting for unvaccinated people to get vaccinated, it's not going to change anything. It's only going to cause further divide. So if you have any more advice than what you just gave, that maybe I'm missing something, I'd be happy to hear it. But you need to know, like,
Yeah, well, this is definitely not the flu. There are not 170 people in the hospital in Fresno County with the flu at any point. So, and that's what we have right now, and those numbers will continue to go up. So, you know,
I was speaking of death. I'm speaking of death. Let's be real clear. I know people are symptomatic and getting hospitalized, but right now it's 0.6 per 100,000. So it's very low. So maybe if it's not the flu, and if it is higher than the flu, apologies, but it's not. It can't be a lot higher than what flu has been in past. It's a very low number. And
well, in the last year, the number of flu deaths in Fresno County was 20 for the entire year. So we've had close to 2,000 deaths from COVID.
Come on. Yeah, you're better than that. You give me previous years, 2020, you can't use those numbers.
No, that was 2019 for the flu deaths. So it's
okay.
So it's exponentially different in terms of its impact on hospitalizations and deaths. And but you're right. I mean, that we make value judgments, and it's not a black and white 100% absolute matter. And so, where do you draw that line? To me, masking is a very simple step that individuals can take to help reduce the spread of COVID and to reduce the curve and to help us get through this the pandemic. And of course, vaccination would be better still. But understanding what are the higher risk situations, which include the crowded indoor settings, encouraging masking wearing in those settings, to me makes a lot of sense. And particularly right now, the other thing that we have going on is our schools are getting ready to reopen, and another crowded indoor setting where kids are not able to get vaccinated for the most part. We are certain to see cases and disruption to education. So what can we do? What simple steps can we take to break this transmission? Well, first of all, yes, get vaccinated, but if not, wear a mask when you're in indoor crowded settings.
Okay, I mean, that makes sense. Just for clarity, I'm vaccinated. My family's vaccinated, and I'm a leader in my church, and I'm happy to share that opinion. But I can't force anyone to do anything. And so, from what I'm hearing, based upon what you're saying, is just keep encouraging those things. I can, but you've still not given me a metric on when it's going to be enough.
We were close. Just a few, there was a month ago where it was okay. If you're vaccinated, you don't need to wear a mask indoors. And so we were definitely moving in a direction where, all of the restrictions on capacity were lifted. So we have made significant movement in terms of how this has been handled. So even thinking about the schools and where you're seeing steady progression there, where again there's no distancing requirements in schools. So I think the effort is to try and have as normal to allow as much normalcy in our lives as possible, but recognizing that we have a deadly pandemic that is still very much alive, that's still going on, and so the mask wearing is if individuals are for whatever reason opposed to vaccination, then masking is the simplest, most effective method we have for reducing transmission. The other concern is that the longer the virus lingers, then the more opportunities it has to mutate. Just like the Delta variant was not here when it started, and now it's estimated to be over 90% of cases are related to Delta now. The virus could mutate again into another potentially more deadly form. So we're playing with fire by taking this lightly.
Yeah, I understand that. I think where you're finding leadership in and across the board, whether it's churches or restaurants or any of that, is you have people like me that I actually agree with you that individuals could mask and be vaccinated and it's going to help things. But if we can't force anyone to do anything, then what are you really asking us to do? We're not going to make rules. We're not going to check people at a door. We're not going to, you know what I mean?
Well, and I think, educating them and having signs up, you're providing an example. I appreciate your engaging in this discussion. There are the folks who attend your services are much more, they're going to listen to you, not to me. So we need to have trusted messengers out there. So I appreciate you bringing up these important points. And from a public health perspective, any hospitalization and death at this point is a preventable one.
And I hear that, but I also feel like this is every topic in the world, whether it's climate change, if it's crime, there's people that are going to do what they're going to do, and I can't stop them.
Yeah.
So I don't know what else to do, if that makes any sense. And so I guess I'm just expressing upwards that, hey, if anyone bothers to ask you what the opinion is, if you try to ask people to like mandate this, that's going to be really tough to convince everybody. And I was on board with it all the way up until once the vaccine became available to everybody, and then it became an individual choice. And I wish more people would personally make a choice to get vaccinated, but just at least cautioning you all that if it comes down that we have to mandate this, you're going to be on rocky ground, because the numbers, in my opinion, don't really back it up. And then secondly, you can't legislate morality, so that's my feedback, and that's all I have. I'll drop it.
Okay. Well, thanks for that feedback. The surge, in terms of the numbers, the surge right now is real, and so our hospitals are feeling it. So I have 31 people in the ICU now. Those are sick people as a result of this, but with those numbers expected to increase. But we all kind of everyone makes determinations based on their own experiences and circumstances about what type of risk that they're willing to accept.
Yeah, and to be clear too, apologies, I knew I said I'd drop it, but you brought up a new point. When you say hospitalizations, we in the past we got percentage of beds and that kind of stuff, because the whole point of this was to flatten the curve, and it was quoted early on that we're all going to get it. Like that was really, it was, you're not decreasing the area of the curve, you're flattening the time that the curve was going to exist so that we wouldn't overwhelm our hospitals. And again, being married to a medical professional, I was fully on board with that. And so now I feel like we did that. We've achieved it to a degree, and at least here locally, we've not overwhelmed. And what's our capacity like? And if we're under the curve, then what's the issue? And I know people are dying, but that, again, you just clarified, that's unvaccinated people. We can't force them. So that secondarily, then I can only care about the next level of community, which is people like my wife who are vaccinated, work in a hospital, and I don't want them harmed. So I'm going to contribute to helping sure that they're not harmed. But if they're not overwhelmed, what's the percentages of beds so that we can have an understanding on how overwhelmed are we or aren't we, to have at least a metric to go back to our churches to say, this is why we're masking, because now innocent people are being harmed. Does that make sense?
Yes, and we're not at that point now, and I don't expect that we will be at that point with this particular surge in terms of overwhelming the hospitals. So if you use that as the metric, I don't expect that our hospitals will be overwhelmed. I think they'll be upwards of several hundred or 200 to 300 individuals who are being hospitalized by the time this surge ends. But I think our hospitals will be able to manage it. Now, that's not the case everywhere. You're reading reports in Louisiana and other places where they are getting overwhelmed. So whatever we can do to help flatten it, again, going back to what are the tools we have at our disposal. Really, it's being situationally aware, crowded indoors, and then vaccination or masking.
Okay, thank you for your time. I do appreciate it.
Thank you, Dr. Zweifler. And yeah, again, I think a lot of good points are brought up, and especially when we consider that obviously we know that there's some people that are, for whatever reason, don't feel like they can get vaccinated or don't want to, or they have some kind of medical condition that prevents them from doing so. And yes, in some ways, it is up to everyone to decide to make those adjustments. But we also understand that everyone can do their part to try to help as well. And I know that as a public health perspective, we always look at it as what can we do to help the public. And again, as of now, the state is a recommendation, even if you're vaccinated, to wear a mask indoors. But for those that are unvaccinated, yes, they should be wearing masks. And again, it's going to go back to education and trying to get those people to hopefully, either get vaccinated or make sure they're wearing a mask when they're inside a store or, with other people. And so that's how it's going to be. And we're going to try to recommend those people to get vaccinated or wear a mask. But we have Sim on. I know you're on the call as well. Do you have any other updates you want to share with the group before I move it over to Ahmad?
No updates from me. If the group does have any questions, feel free to email myself. It was the email that you received this calendar invite in. So if you guys have any questions, it could be COVID related, vaccine related, whatever it is, just send it our way and we'll try to get back to you as quickly as we can. Thank you.
All right, thank you, Sim. Ahmad, do you want to jump on? Or did he jump off?
No, I'm here. Thanks, Alejandro. I'll keep this really quick and brief. So some of you may be aware, if you've been following the news, at least last year we saw some surges here in Fresno County of pills and counterfeit pills that had traces of fentanyl and had resulted in some overdoses and some issues. Dr. Zweifler may remember that. And so there was some efforts done around that last year. And then around this year, March again, we started seeing a surge in instances of overdoses and sadly deaths resulting from overdoses with fentanyl. So some have been directly fentanyl pills, some have been other pills with traces of fentanyl in it, some of it have been counterfeits where people weren't even expecting it to be that. But it is something that has really garnered the attention of the community. And so we're working across sectors to try to address that. I know there's a number of calls that we've been on working. Dr. Zweifler has been on that, public health, the county superintendent of schools, the DA, law enforcement, et cetera, working to try to address that. Just to give you guys some context, and Sim and I were looking at these numbers last year. I mean, our overdoses from 2019 to 2020 increased by 50%. Deaths by overdoses, that doesn't even count the number of overdoses that people survive, overdoses that people don't report because maybe they've used Narcan, maybe paramedics got to them before they got to the hospital, whatever it may be. But we've seen a significant increase in those in the past year and a half. And last year we had 40 overdoses related to fentanyl. As of thus far, as of this week in 2021, we have 27 deaths. So we still have about 4 months left in the year, and we're about to catch the number of deaths that we had last year as a result of fentanyl. And then I want to just raise everyone's awareness about substance use in general. Last year we had over 120 deaths related to methamphetamine overdoses. So unfortunately, we're seeing a rise in this area. But right now we're putting some concerted effort into trying to educate and make people aware of the dangers of fentanyl, that it's out there, what is it, why it's dangerous, et cetera. And at the same time, trying to provide some information about resources such as Narcan, otherwise known as naloxone. Did I pronounce that right? Sam, I keep getting that wrong. That's why I say the generic Narcan term. Information on what it is, where people can get it, things of that sort. I know there's been some churches and faith communities in the past year that have started supplying or making, getting supplies of Narcan, making that available to people who want to. So what we have done is invested in creating assets that the community can use. And so instead of us, going out on our own and trying to do a TV commercials or something like that, what we've done is try to create a lot of assets that then our community can use, because it's an issue that's way beyond, one or two departments or one or two sectors doing it. Something that we feel needs to be community wide. And so what we've done with those assets is we've created everything from videos, brochures, posters. Can I share my screen?
Yeah, you can share it.
Okay, let me see if I can figure out to do that. I'll try to. So I'll show you guys like a quick, example of. Is it going? Sure. So like this, if you're able to see, is it, for example, a poster that could be utilized. So SIMS team and public health, we are co-branding a lot of things. So you see the Department of Behavioral Health logo. We're going to be doing, public health logo, but we created these assets on purpose to where they could be co-branded. And by that mean is almost all of the materials, and we're having them translated into English, Spanish. So if you've got, more diverse audiences that need different language, we have those available too, to where you would be able to put your own logo into it. So it is co-branded. So it's not that you are pushing someone else's content, but it's content that can be yours. And these are simple things as just digital things that you can put on your social media pages, things that you could put on your website, things that you could send out in an email blast. We've got videos, and we can send you the files to those, or you can even just pull them off of YouTube and share them. They're 15-second, 30-second videos. Some focus on awareness around fentanyl, some are around Narcan, some are about how to access treatment. And then we've created a landing page, which is opioidsafefresno.com, to where the DA's office, the superintendent of schools, public health, us, we're able to direct people if they want more info to go to one site that is being utilized throughout the county, where it has some, again, additional information that'll also be updated over this weekend. There's some resources on there that you can download, but these files, if you guys are interested in them, what we're planning on doing is making a couple more updates, putting a couple more items in the file. And hopefully next week sometime, we'll working through public health, be able to send you what will be a link. So it'll be a Google link. You open it up and there will be all the files, and you can go and pick and choose which ones work for you. You can download them and use them. You can download them. And if you've got somebody that knows how to do graphics with the PDFs, you can drop your logos into it. So it could be yours and, whatever community church. And so that way you guys can really co-brand them. And I think going to Dr. Zweifer's comment earlier, there's definitely a lot of strengths that our faith communities have. You guys are a trusted resource. You may be able to share some of this information and awareness to an audience that maybe we're not capturing, or may not be on social media or something like that. So even having like a poster before services or things like that might be another way to increase. And we really ask and want to see if you guys can share this information when we do make it available to you, if you have any youth pastors that work with youth groups, youth ministries, because that's an area that unfortunately we've seen a really high uptake in terms of usage of the fentanyl and the OD deaths. And so really we want to get out in front of it. We're doing a two-pronged obviously approach. One is raising awareness, and the other one is harm reduction, which is explaining what Narcan is, how people can have it, get trained in it. The information has all the places in Fresno County that people can go get it. Worst case, for about $25, you can get it at some pharmacies, but I've heard people talk about it as just being another resource that they put in their first aid kit, not because you have someone using, but unfortunately, we all know too often as parents, we say, not my kid, or, my kid doesn't have that issue, or I, just don't have time to maybe bring that up. That's an uncomfortable conversation. Or the worst one that I'm always worried about is like, at what age do I start having that conversation with them? Like, what's too young? And so those apprehensions a lot of times are things that we don't get around to addressing. And unfortunately, when we've heard from families, and some of you that may have worked with families through that loss, when they're grieving, have said, they wish they'd had that conversation. They wish they had taken those steps. They wish they had done something. So that's part of the harm reduction approach is, we want to keep people alive as well, so we can have that conversation and try to help them with treatment. So just real quickly, these are just some of the assets. Like I said, there's videos, there's digital, there's posters, there's the brochures, which is the ones we really think are going to be impactful because it's all the information they need is on there. And again, if you go to opioidsafefresno.com, and for a lot of the information that's in these materials that are in the brochures are also found on there as well. So hopefully next week we'll be able to get you guys that link out in an email, and then it's up to you if you want to download and use any of those. You totally can. And like I said, these are created specifically for the purpose where you can even co-brand and put your logo or information on there to make sure that, you know, something that you feel comfortable putting out as well. So I don't know if there's any questions or anything like that, but I'd be happy to try to answer them the best I can. I know that went over like 2-3 minutes, but I want to make sure I get all the info out there.
Thank you, Ahmad, for providing that information. And if you'd be so kind to send out that information our way, we'll make sure to share it out with the rest of the group.
Absolutely. What I'll do is as soon as all the assets are updated and ready to go, we will get that to Public Health for you guys to share, Alejandra. And we'll also put links to some of the additional web pages on our on the county website that has everything from the opioid save to there's a whole page on tips on things and that parents can do on how to start those conversations with your young person, with your teenagers, and to just kind of broach the subject that a lot of times is not just difficult for our young people, but it's difficult for us as I think parents sometimes are like, well, how do I approach this? So we'll put all that information in there, get it to our faith communities. And at that point, you know, please take and use what you can, and whatever doesn't work for you, that's also fine as well.
Thank you so much, Ahmad. Rebecca, do you want to share any updates?
We continue having clinics throughout Fresno County. Tomorrow we'll be out at Viking Village at 4250 North Chestnut. We'll also be at Trinity Lutheran Church from 5 to 8 p.m. And Fresco 4 to 6 p.m. So if anyone in the community wants to join those events. We also have events that are going to be posted on our website. So follow our website, and if anyone's interested in hosting an event or would like more education, please feel free to reach out.
Okay, thank you so much for the information. Are there any additional questions this week? Okay, I'm not seeing anything, not hearing anything. So our meetings are once a month, but again, we're still here. If you guys have other additional questions or if anything should come up, we'll also make sure to send out an email or more information. And again, visit our website. Sim provided that in the chat for more information on COVID-19 vaccine. And again, we'll talk very soon. We'll send out the information from Ahmad. And I'd like to thank all of you guys for joining us on your call, and stay safe out there.
Thank you.